St. Lucia, we are back for the second segment of our program, and now the floor is going to be that of Dr. George, who is going to highlight the areas she has been concentrating on, so to put the mind of some St. Lucians at rest that we are indeed in good hands. Dr. George.
Thank you, Mr. Shastley. I think, first of all, persons need to know a little bit about Ebola, that it's a viral hemorrhagic disease. It does have a high fatality rate. It has an incubation period from 2 to 21 days. That is to say, if you're first in contact with somebody with the disease, it would take between 2 and 21 days for you to start developing signs and symptoms. Generally, between 7 and 14 days, persons would start showing signs and symptoms. The early signs and symptoms include fever, joint pain, body pain, generalized weakness. It could later progress to diarrhea, vomiting. It's one of the viral hemorrhagic diseases. So persons develop bleeding from different parts of the body.
Different parts, internally or internally?
Both internally and externally. They
okay.
could start bleeding from the eyes, from the mouth, from the nose, and also from the skin. Also, you get internal bleeding, that when persons vomit, they vomit out
because
with
of
blood,
inside, yeah.
and they vomit out. When they have the diarrhea, it becomes bloody as well.
But you know, Dr. George, I hear what you say, but there are many viruses with similar symptoms.
Very similar. That's a very important point, because
yeah.
our dengue fever, which we have here, our chikungunya,
yes.
our leptospirosis,
yes.
start off with very similar signs
yeah.
and symptoms.
Yeah.
Of importance for persons who develop those symptoms would be their travel history.
Mm-hmm.
So
yeah.
somebody developing those
yeah.
symptoms
mm-hmm.
with a travel history to one of the countries where there is an outbreak would be very significant in terms of the management forward.
Mm-hmm.
The other point I also want to indicate that during the incubation period, that is the period from first contact with somebody who is ill to the development of signs and symptoms, generally persons are not, the risk of infection is very low or does not exist. Usually there is no risk of infection during that incubation period. So if somebody was in contact with the virus, once they are okay, they have not started developing signs and symptoms,
mm-hmm.
they're not infectious, the disease is not transmitted.
But the difficult part is, let us assume that the person is definitely through the incubation period. Yes. The transition from the incubation period to the actual infection,
yes.
Does it happen dramatically?
Usually the early signs and symptoms would be the high fever, the body pain, the joint pain.
But as we said earlier,
and
it
is similar to the other, but the risk of infection during that period is low.
Yeah.
And because Ebola is spread through direct contact with bodily fluids, mm-hmm. it's usually when the bloody diarrhea, the
yeah.
vomiting,
so
and you get into contact with those fluids,
it becomes very significant automatically.
It becomes,
yeah.
you become infectious,
yeah.
so, and it is not airborne as well.
Yeah, but of course, St. Lucians, I want you to listen very carefully so that you all can be on alert. A person who, let us say, who is definitely in the incubation period and we don't know, and let's say it transmits, say, in the last 48 hours, people are normally very optimistic in life. They always tell you, oh, I have a cold, but I don't have tuberculosis, okay?
Yes.
Now, because they're optimistic. Mm-hmm. Now, it's left then to the person to be honest. If, for instance, they are having bleeding, okay? They go to the bathroom, for instance, and they are bleeding. They may not say it the same day. They may want to hold off a day or two. These are unfortunately the risks that will happen, and then people around them, then they're in the position of passing the infection. But I don't think, that's only, I'm playing devil's advocate,
yes.
okay? But I think normally people, that is one of the good things about this program today, to drum home to St. Lucians that they must be alert when they are having these symptoms, to ensure that it is not that it is something else?
Well, it's we don't want to alarm persons,
Right.
because you can develop symptoms, like I said, which we have dengue fever here, we have chikungunya. But if you don't have the recent travel to a West African state, it would be difficult for it to be Ebola, for example.
Right.
So in terms of, for example, our healthcare practitioners, the history of travel would be very important in terms of
But
determining.
you know, that must be a Herculean task for you, because you know you have quite a few hundred people coming a day, like on a Saturday or on a Sunday
Well,
alone. You have 2,500 people coming in. Then when you have the cruise ships coming in, which is about 600,000 a year, I know we're going to deal with that later, how we're going to do it. But it's a lot of people, and it is going to be a lot of work. It's quite onerous on the Ministry of Health to document that kind of information.
But as I don't know, you may be aware that we have reinstituted the Port Health Program, where we have nurses at the ports. And we are also in collaboration with immigration and the airlines. We're able to get information on persons' travel history.
Yes.
So we're targeting persons who have had the history of travel within the last 21 days. Those are the persons of interest. It will not be everybody, and it will not be persons from all parts of Africa. As we are aware, the areas where the outbreak
started.
And where it is increasing quite rapidly would be Sierra Leone, Guinea and Liberia. And we're also working with the Ministry of Foreign Affairs in terms of giving us information on persons who...
Question for you. When assuming that a person is suspected, or you want to investigate a person, how does it take place? The person arrives at the airport, and what's the procedure?
Okay, what we have done with the Port Health Program is, for example, for St. Lucia, we have students who've returned from visits, for example, from Nigeria.
Yes.
We have that information, which I don't know if you're aware that to visit St. Lucia, you would need to get a visa. So we have the information on persons coming in, and also information on persons with a travel history. Right. We've been working with the medical schools, with the different religious associations as well, where we have focal points at those organizations. So persons coming in, we would know where you are, and we would be monitoring. We have surveillance teams in place, regional surveillance teams, who monitor persons for the development of symptoms, if they do, after a recent travel to Africa. We've had to put a number of measures in place to improve our surveillance and also to manage, because we have other groups who we also had to do quite a bit of sensitization on. For example, our healthcare workers, the St. Lucia Fire Service, our port workers, which include customs, immigration, SLASPA, and also the Airline Association. We've also had to have meetings with our hotels and guest houses, because persons who come in who may have had a history of travel, maybe staying at a hotel, for example. I was going to raise
that point,
we've had sensitization with, for example, the Taxi Association, the funeral parlors, because handling persons who've had Ebola requires special arrangements as well. Right. The Ministry of Agriculture, NEMO as well. And we recently met with both the Catholic and the non-Catholic denominations. In terms of, I started speaking earlier of our active surveillance system that we had to ensure that we have in terms of the monitoring of persons who may have had a travel history, and even in terms of, we've had to have on-call teams as well to be able to respond if in case we were to get a suspect case. In terms of the hospital, from very early in August, we have had to put our healthcare facilities on alert in terms of preparedness, ensuring that they have, for example, an isolation room. And all of the three, the Victoria Hospital, the St. Jude Hospital, and the Tapia Hospital have identified isolation rooms in the event that we were to get a case where somebody could be isolated and managed in an efficient way.
Now, that has been a little concern of mine, using a hospital for that. Because I'm just throwing out the question to you. The United States, we are on the doorstep of the United States. We have a lot of travel to the United States. And although at this point in time, it seems rather remote, don't you think that they should be maybe approach the US to have, say, 2 or 3 clinics away from the hospitals where they can put those people, so there's absolutely no chance of, because a person at a hospital is already sick, and you know, usually their immune system is low. They can easier to catch an infection. I'm only asking, I'm not a doctor, I'm just putting that to you.
Yes, we have to look at the resources available, and we also have to look at the science of the disease and what works. Somebody who's a suspect case would mean that that person has had the history of travel and have developed the signs and symptoms of the disease. That person would definitely need supportive care, because with the Ebola viral disease, we don't have a cure, we don't have a vaccine against it. So it's a lot of supportive care which would be needed and would be at a hospital. So we would need to have the isolation rooms at the hospitals.
Yes.
And all of the 3 institutions, Victoria Hospital, the St. Jude Hospital, and the Tapio Hospital, have identified isolation areas where the person would be away from the rest of the hospital staff and patients as well.
Yeah. What are the
we have also ensured that we have personal protective equipment for our healthcare workers, because when we look at the history of Ebola, we look at the pattern in the other countries that have been affected. Unfortunately, it's our healthcare workers are the ones who are at greater risk of contracting the disease. Because for example, during the incubation period, where if somebody is well enough to travel, because they're not infectious, and even in the early stages, persons, for example, at the ports would be very, very low risk. So they're not regarded at high risk in terms of developing the disease. It would be our healthcare workers that are dealing directly with those patients and persons who are taking care of somebody who's sick with the disease. So we've had to ensure that we have a stock of personal protective equipment, so that in the event, if we were to get a case in St. Lucia, we would be able to protect our workers, because in a lot of the countries where outbreaks have happened, it actually reduces the possibility of control, where you have your line staff, your doctors and nurses who are necessary to treat and reduce the spread, are the ones who may also end up getting infected. So it is of concern to us, because the safety of our staff is of extreme importance. So we have distributed to all of our healthcare facilities. We've put them on alert. They have identified areas, if in the event that a client were to come and is a suspect case, to be able to manage in an efficient manner.
Well, Dr. George, I must say that in this short period, I've learned a lot from you, and I think St. Lucians will certainly appreciate the information provided by you, because, you know, to many of us, Ebola is just a name, but it is a dangerous name, and I think we need to be extremely cautious. The important thing is to watch what is going on, the same way that the police require information when a crime takes place. This is a form of criminology. Comes in a medical form, and I hope that St. Lucians have listened carefully to what Dr. George has said, because despite the brevity of her presence here today, what she has uttered is extremely important. And this is Open Mic, coming to the end of our second segment, and we'll be right back.